Can everyone hear me? Yes. Okay, perfect. Okay, we're gonna get started in about 2 minutes. Just waiting for a few more people to join. And then I have received several questions from participants, and I will go through all of those after I conclude my presentation, just so everyone knows what the plan is. All right, guys, we are at 6:30 Central Time, so I am going to get started. I'll start by introducing myself. I am Jordan Newman. I'm one of the nurse practitioners here at Peak Health Institute, and my background includes starting as a nurse in the emergency department and then transitioning to allergy immunology as a nurse and thereafter doing a lot of my doctorate work in parallel with some of the COVID-19 monoclonal antibody research, a lot of immunology focus, and really immunology has become one of my bigger focuses in practice. So I see a lot of mast cell patients, obviously a lot of chronic illness with Lyme, mold, various infections. And I am often doing a pretty significant deep dive on people, to kind of understand what's going on with the body so that we can best support you and get you moving in the right direction to healing. And that's what we're going to be discussing today. So, giving a little bit of a high level overview of the immune system, then transitioning to um, you know, how we need to look at the workup as a clinical team to really make sure we're looking at all aspects that contribute to immune function. And then finally diving into some of the solutions that we offer at Peak and going through how those specifically help the body. Okay. And then at the end, I have received several questions from the attendees, and I will go through those questions and give you a high level overview. Some of them will be answered in the presentation, but I'll still address them, even if they're covered in the presentation. Okay. Um, if there are any questions that come up, you can always put them in the chat. I am not going to address them until the end just because I'm reading the presentation. All right, and without further ado, we'll get started. Okay. So your immune system is broken up into two defensive layers. Okay. You've got the innate immunity, which acts really quickly, and it's a very generalized approach. So there's no specification on how we're addressing, a viral illness versus a parasite. Okay. Versus the adaptive immunity is very targeted, very specific. Uh, the B cells create antibodies to specifically target antigens that are coming in from foreign invaders and are designed to prevent that invasion per se. Okay. Takes a little longer. And the signaling is reliant on the balance of the immune system and your baseline B and T cell strength, if that makes sense. There are two different parts of the adaptive immune system, Th1 and Th2. I'm not going to go into great detail on those, but it's really key to ensure that there is an adequate balance of that to keep immunity optimized. Okay, and we'll get into that a little bit further. So here is a breakdown of innate immunity versus the adaptive immunity, and specifically some of the different cells that play big roles in these pieces. Something that's not listed here is mast cells, but that's more in that innate immunity piece. And we'll also get into that because that is a big piece of immune dysfunction and a lot of what I do. Like I was mentioning, the key to optimization of immune function really does rely on the balance of the adaptive immune system. So there are pro-inflammatory cytokines and uh, anti-inflammatory cytokines. Okay. Those different signals in the body are turned on and off based on what our immune system is telling it to do. Okay. So if your body is perceiving a significant threat, and it is, um, responding in a weak manner, we are going to have frequent illness. We're going to be significantly fatigued. We might have extended illness, and, healing is slow typically. So that explains the underactive immune situation. Too active can result in something like autoimmune, something like Hashimoto's, where we have antibodies attacking an organ like the thyroid, causing damage. Similarly, rheumatoid arthritis, where we have joint degradation, breakdown of the joint space because the body is attacking itself. Okay. And this is also an example of, how the body responds from an allergy perspective, from a mast cell perspective, and in worst case scenario, cytokine storms, which can result in significant dysfunction of the body. The key is really to balance the immune system. Okay. So what we want to do is have that first line of attack get the pathogen addressed, get plenty of white blood cells, natural killer cells on board to clear the threat, and then recruit the B cells, the T cells, other specialized antibodies to fully clear pathogen. Okay. And when I say pathogen, that includes virus, Lyme, bacteria, mold. And we will talk a little bit about those next. Okay. Your body is protected from an immune standpoint in several different ways. They are listed here. Um, we often talk about how, number one here, the skin and the mucosal barriers can be very indicative of internal inflammation. So when I see people with acne or rashes, I'm always like, what's going on in the gut? What's going on with the immune system? Are we inflamed? Let's peek at the inflammatory markers. Let's take a deeper dive into what's going on. Similarly, very frequently in mold illness, I am looking at the mucosal barriers, particularly the sinuses, to see, have we been inhaling a significant amount of uh, mold mycotoxin through the nares, which is the predominant way that we, inhale mold. Doing like Marcon's testing, where we are looking for resistant bacteria, fungal uh, colonization, biofilm presence that's preventing our ability to effectively penetrate organism and treat and clear. Okay. The bone marrow is a really primary driver of stem cells for immune function, um, and plays a really big role in clearing those more complex pathogens. Okay. The thymus, and we'll get into this, plays a very, very big role in T cell production. So, thymus for T cell, that's an easy way to remember it. The spleen, which is a lesser known organ that plays a very big role in the immune function, is the spleen. Okay, so technically you can live without a spleen, but it is very productive in helping filter out pathogen in the blood, helping with autophagy, cellular cleanup, etc. Okay. The lymphatic system is something that's very important for uh, almost, identifying pathogen, storing pathogen, and then moving it out of the body. Okay. Typically, in patients that I'm working with, we're always trying to find a way to effectively move the lymph so that we are clearing pathogen. Um, and, when you are chronically ill, it's not uncommon to have some stagnant lymph, right? So your lymph gets built up and you need to move it through to detoxify it and move pathogen through the body for excretion. Okay. And then finally, white blood cells. T cells, B cells, we've got neutrophils, leukocytes, monocytes, all those things we test for and take a deeper look at. So just to, this is a really big piece of what we do at Peak. Stealth pathogens are one of the primary issues with several, dozen patients that I see regularly. The way that stealth pathogens work is they enter the body and then they hide. Okay. So while we might have an acute infection where we get something like Epstein-Barr virus as a teenager, your body still technically has the memory cells to treat that, but it also can have a higher viral load based on what you are exposed to day to day. Okay. So these stealth infections are really smart in that they try to mimic the body's own cells so that they can hide in the system. Okay. And I've already mentioned once there is something called biofilms, which is a protective barrier that these pathogens create to prevent effective penetration and treatment of them, which is something that we have to be very mindful of with some of these more difficult to treat cases. Okay. And then finally, these stealth pathogens also drive up those pro-inflammatory cytokines and drive down the anti-inflammatory cytokines. They create this cascade of cell danger response sometimes. And when we have multiple pathogens on board is when we see the most issues, okay? It's almost like every person has a specific immune function capacity. And when you've hit the top limit of your immune capacity, that's when we tend to run into issues, okay? Um, the stealth pathogens, as some of you may know from experience, can result in those feelings of chronic inflammation. So joint pain, brain fog, skin issues, um, and can result in permeating the very delicate gut lining, which we'll get into a little more. They can wreak havoc on hormones and, cause issues with like chronic headaches, brain dysfunction, memory issues, etc. Some of the barriers to healing include just not looking deep enough into the total picture. Okay. So that's what we really strive to do at Peak and what I do with my patients. Specifically looking at multiple facets of the function of the body as a whole, not only with the immune system, but also looking at inflammatory markers. Do we have nutrient deficiencies that result in a weakened immune system? Do we have poor mitochondrial dysfunction? Are we chronically dragging through the day despite getting a ton of sleep? Okay. What does our gut look like? Are we regularly eliminating on a daily basis. Some people tell me that they're going twice a week with a bowel movement, and that is not adequate to eliminate some of this buildup of toxin and pathogen that can accumulate in the body. Also, it's very important to have a very strong gut lining to ensure that the immune cells that are largely present in the small intestine and the gut per se are not crossing over into the bloodstream and causing inflammation. Okay. Um, Adrenal function, cortisol plays a very, very big role, and we'll get into this when we talk a little bit about nervous system and the connection with the immune function. But too much stress creates inflammation, which then can create a myriad of issues with immune function. Okay. We touched on a little bit about the toxic burden and everybody having a certain capacity. The same applies for toxic burden, okay? Everybody has a certain capacity in their body for toxin. Everybody has a certain capacity for ability to detox. Some people's are slower, some people's are fast. Some people can only handle a little bit, while others have what seems like an endless ability to ingest alcohol and heavy metals and eat sushi and all these things. And it's really about finding what the individual needs for support there. Um, and finally, we've just got to plain and simple balance that immune dysfunction by peeking at, um, cytokine distribution, inflammatory markers, and what hidden infections could be present. So this is an example of some of the labs that I regularly do when someone comes to me and is describing chronic fatigue, pain, brain fog, frequent illness. Um, you know, I do have a few people that come for, fertility workups. That is a really common one more recently. And what we're looking at here are those stealth pathogens, inflammatory markers, cytokines, um, and your baseline immune function. Okay. So things like immunoglobulins and the subclasses tell us what is your adaptive immune response looking like? Are we able to adequately mount an immune response to protect the body from foreign invaders? Okay. The same applies to the strep pneumococcal titers. That is specifically something I look at very often for, are we getting recurrent upper respiratory infection? What's going on there? Okay. The cytokine panel that I look at looks at, are we seeing elevated pro-inflammatory cytokines? Are we seeing low protective cytokines? How can we balance that out a little better? Okay. Um, and then again, like I said, a lot of these represent stealth pathogens. Okay. So now we're going to get into, how do we support the immune system? Okay. It's always important to start with the foundations. Okay. If we're eating fast food every day, we're sleeping 4 hours a night, we're not moving our body, we are extremely stressed and overweight, we are not going to see very good outcomes with any of these therapies that I mentioned next. So it's very important to have a good foundation. And, in this day and age, there are several factors that cut into these basic wellness practices, but it is very important to get your foundations right. Okay, so this here lists the ways that you can adequately support your immune system without taking a single supplement, without doing any additional treatments. And these baseline foundations are very important. Okay, and we'll get into why. Okay. Want to dig into the role of gut health and immune function? I mentioned it a little bit, but 70% of our immune cells are in the digestive tract. So that points out just how important having a sound microbiome, a secure gut lining, regular bowel movements, really tuning into what's going on with my gut health. Am I chronically feeling bloated? Am I feeling like I'm digesting food well? Do I have signs of inflammation in the gut, like blood in the stool, mucus in the stool? Any of those things are things that we dive into in a workup, okay? And the gut lining has a very susceptible single layer of epithelial cells that serves as a barrier to those external threats. But when it becomes permeated or leaky, which is often heard, we have issues with immune cells crossing into the bloodstream, which can cause issues with defending the body from pathogen, okay, and can create inflammation systemically. So adequately enforcing the gut lining and balancing the microbiome is essential for keeping out those foreign invaders, okay? Phase 2 and 3 of detox also occurs in the small and large intestines and is critical for clearing the total body burden of toxin, pathogen, um, and moving us in the right direction from an immune function. That brings us to detox. So, daily habits as far as plastic consumption, personal care products, alcohol, cigarette consumption. Nowadays, there's a lot of Zyn use, environmental exposures, with water, PFAS, metals, etc. All of these things can weaken the immune function because they can weaken the cellular function. When the cells are compromised, as in the cell membrane is not strong, the mitochondria are feeling a lot of burden, we will run into issues with cellular function that translates into immune dysfunction. Okay. So we talk in practice about reducing the burden on the body regularly by supporting phases 1, 2, and 3 of detox. Those occur in the gallbladder, the liver, the small and the large intestine, and ultimately the colon. Okay. And also through the kidneys. Okay. With detoxification through urination. Okay. Typical detoxification strategies look like regular bowel movement, regular urination, and then we use various liver detoxification agents, bile movers, glutathione, liver sauce, to name a few, and pair those with some binders to effectively pull out toxin from the body. And this is a list of some of those that are used. When we have patients that are not effectively having a regular bowel movement or tolerating detoxification without feeling extremely fatigued or inflamed, sometimes we have to go back to the drawing board and look at the cell function. Okay, so are we supporting the cell membrane effectively? Um, do we have anti-inflammatory support on board? Do the cells have enough micronutrients to function, to do their basic needs? Okay. And then I did get a few questions about the nervous system and immune function. This is a big one, and I've been seeing this more and more with people who have kind of the trifecta of illness, including some of the stealth infections on board, mold illness, Lyme disease, to name a few. Sometimes people have long COVID on top of it. All of these things come together to create something called the cell danger response. Okay. External threats can cause our cell membranes to weaken, our mitochondrial function to weaken. It can increase inflammation and cause ATP to become extracellular. Okay, so that means almost like a feeling of jitteriness in the body, right? The cells get stuck and then they cannot effectively perform their roles to clear pathogens. Okay. Additionally, trauma or post-traumatic stress can turn on pro-inflammatory cytokines and result in the chronic inflammation cascade. Okay. The same reigns true for elevated cortisol. It has the same effect. And when we have that chronically elevated cortisol, that inflammation results. Okay. I did mention mast cell activation syndrome. MCAS is a result of overactive mast cells in response to an external threat. So degranulation occurs when the mast cells recognize a foreign invader and they release histamine, tryptase, cytokines in an effort to kind of wave their white flags to the immune cells to say, help me, help me, help me. And sometimes that can be overdone, resulting in excess release of histamine, tryptase, cytokines, etc. Okay. Now we're going to get into some of the therapies that we offer at Peak to optimize the immune function. Okay, this is a high-level overview of everything we offer. I think I'm probably missing some things, and this will not be completely inclusive, but these are the things that are my go-tos for healing the body effectively and moving people in the right direction. There's really no specific order to this, and everyone is a different case, but we'll get into each of these and describe how they work. Okay. The first line for people that are just starting out is let's look at the deficiencies, right? If we're not supporting vitamin D, vitamin C, zinc, we have basic cellular dysfunction that can be occurring. Okay. Those are key nutrients to support the immune system. Some of the other things that I use are transfer factor multi-immune, which has resveratrol, um, colostrum derivatives. I mentioned SBI Protect, which is highly effective immunoglobulin therapy to boost immune function and help the gut lining. Okay, and then phosphatidylcholine is one that I'll touch on further that helps really reinforce the cell membrane. Okay. Ozone therapy is one of my favorite therapies at Peak. It is a triple oxygenation therapy that specifically works to stimulate immune function and balance the Th1 and Th2 dysfunction that is often occurring in these chronic illnesses. Specifically, ozone prompts an adaptive oxidative stress in the body that then strengthens your antioxidant defenses and modulates the immune and inflammatory signaling. Okay, so think upregulation of NAD, which is energy producing, increased detoxification within the body, and promotion of um, anti-inflammatory cytokine, okay, processes. Thymosin alpha is one of my favorite peptides to use for immune function, specifically supports T cell immune function. Okay, so I use this for Lyme patients, mold patients, parasites, virus, bacterial infection, and I even use this in cancer patients as adjunct therapy if, we've got some other supports on board. The reason why it's so effective is it promotes T cell maturation and helps balance that immune response again. Okay. So it's boosting the immune function without doing too much. Okay. Very, very effective therapy, and very easy to initiate, either orally or injectable. KPV has been a peptide that has been highly sought after recently, especially, and I really love it for its anti-inflammatory properties. Okay. Very effective at lowering those pro-inflammatory cytokines. And while most therapies that are used for similar activities, something like Humira or these biologics, are intended to reduce the inflammation, they also tend to reduce your ability to respond to external pathogen. Okay. So you're bringing down the inflammation with these drugs, but you're also bringing down your immune function. KPV allows us to bring down that inflammation while keeping the immune function stable and keeping it strong. Okay. And I see very, very good outcomes for gut healing, cell danger response, skin issues, joint pain, mold illness. I think I could keep going on and on. This is highly effective for supporting the body. Mast cell. So really like this one. Low-dose naltrexone is a prescription option, which is an immunomodulator. Specifically came on the scene as predominantly helpful for pain, for chronic pain, fibromyalgia, which is typically a result of some of these stealth pathogens, chronic inflammation, cell danger response, etc. And LDN is particularly helpful for helping the body regulate its own immune function. Okay, so again, promoting that balance of immune function with the Th1 and the Th2. This is typically something that I have people take at night. Um, and the dosing is a gradual increase. I tend to find this either works or doesn't really move the dial for people. So it's really one or the other typically. It's kind of interesting how there's not as much of an in between with this therapy, but can work wonders for people. I also use this in Hashimoto's patients to help bring down antibodies. High dose vitamin C is a very effective therapy to boost peroxidase um, production in the cells, which effectively oxidizes the body. Okay. Pathogens do not thrive in an oxygen rich environment. Okay. So when we can oxidize the system, they don't do very well and our immune function can thrive. Okay. Um, Very helpful for collagen synthesis. So think joint pain, um, for helping your cells thrive, uh, to, initiate the activities with T cells, B cells, antigens, antibodies, etc. Um, and very, very effective for or artery lining to protect the endothelial cells. Poly-MBA is something that we have just started doing in the clinic. We do both oral and IV therapy. I have been blown away by this specific therapy and its amazing results with the cell danger response for people with multiple infections and kind of years of trying to figure out what's going on. Specifically, it is a mineral complex pairing alpha lipoic acid with palladium, B vitamins, and trace minerals. Typically, I use this for supporting mitochondrial function, boosting antioxidant support, and helping reduce the oxidative stress on the cells. So this is a great therapy for those people who might not be tolerating detox yet, but need to really heal the cell membrane, get the cells functioning stronger. Um, I've seen great outcomes with this. And yeah, cannot recommend this enough. Phosphatidylcholine is a important nutrient for the cell membrane support. Okay. Phosphatidylcholine helps rebuild cell membranes, which can be degraded with pathogen. Okay. It also builds that baseline, that groundwork for immune cells and helps with brain function, specifically for cognition and memory support, and nutrient transport and toxin clearance. I use this a lot in mold patients for first line therapy for detox if they're not doing well with like a glutathione and a binder combination. GLP-1s and GLP-1s and GIPs, so think Ozempic, Mounjaro, Wegovy, etc. Semaglutide and tirzepatide are the peptide names for these medications. Very, very effective in the data in reducing inflammation in the body and helping further mitigate some of the cytokine elevation, um, and specifically in chronic inflammation for patients. So there are a lot of new studies coming out on the use of these medications for reducing um, cardiovascular disease risk, reducing cancer risk, reducing metastases of cancer. It's been pretty profound to see some of these new studies come out. And I think we're going to see more and more that these medications have multiple purposes for immune function. And then finally, stem cell and exosome therapy. So stem cell therapy is more of a um, direct support for healing and regenerating tissue. Okay. Um, whereas the exosomes are messenger cells that specifically tell the cells that are already present in the body how to respond. Okay. So they are telling, you know, player A, you need to go over here and address that infarct that's coming in. Player B, you need to take a step back and sit on the bench for a minute. You're too pro-inflammatory. Um, Very helpful for creating that homeostasis in the body. Um, so typically when I think about the way that these are used, you know, for an example, I can think of stem cells were used for one of our patients who had damage in their lungs from COVID infection. Specifically, we did an inhalation and an IV infusion of stem cells, and that very, very effectively fixed and replaced his damaged cells that were present in the lungs, allowed him to reduce shortness of breath. So really, really profound therapy with the stem cells in that way. And then for exosomes, um, the way that we've used those is typically through IV infusion to give the body what it needs to direct the immune system to perform its various tasks. Okay. This is a great example of something that could be used for someone with low immune function that doesn't have access to pharmaceuticals or is looking for an alternative approach of a more root cause. Okay. And the exosomes are very, very safe, very well tolerated. The stem cells we need to screen for like cancer risk, et cetera. So there's a little bit of a nuance to it. Okay. All right, guys, here are some of my sources. I am going to stop sharing my screen and get to some of these questions and peek if anyone has entered anything in the chat too. Okay. All right, I don't see any questions, so I am going to go to the questions that were asked. Okay. Um, One of the questions was, what is the connection to long haul COVID and viral issues? Okay. Spike proteins can initiate inflammation, alter the endothelial barrier of arterial walls and veins, and trigger pro-inflammatory blood clots. So all of those things can make it very problematic um, with fighting off other viral infections can cause people to get sick easier, okay? Can make you more susceptible to illness, okay? Um, Another question was, what is the top treatment for inflammation in the body? That is extremely nuanced. I would say we really have to look at what's going on in the body when we kind of do a deep dive on those labs. What kind of basic support do we need? Can we tolerate detox? You know, where do we want to kind of start here? Okay. Next question, what is the most important first step to dealing with chronic inflammation and calming the immune system? Okay. The most important first step is identifying some of those deficiencies that exist, I think, and understanding what cytokines are elevated, what cytokines are down. Um, do we need to support T cells, B cells, natural killer cells? Typically, the first step in doing that is going to be doing the labs. Okay. And then I think that I touched on the next question about how the immune system dysregulation relates to nervous system dysfunction. That elevated cortisol, that trauma, that stress is going to drive up inflammation, causing issues with, um, the function of the cells at a baseline level and alter the balance of the Th1 and Th2 immune function. Okay. The IVs that we work with, I think I touched on those. We work with several different supplements. So that was a very short list that I mentioned in the therapies that I went through, but there are so many options. There are herbs, there are tinctures, there are um, homeopathy, vitamins, minerals, all of those pieces, cell membrane supports, and all of those things are tailored to the patient based on their needs. Foods that contribute to out of control immune system. I think that typically, as a blanket statement, I can say processed foods don't do many people many good things in the body when it comes to function, right? The body does not recognize processed foods as adequate sources of nutrients in a lot of cases. They are sometimes genetically modified, sometimes not even real food ingredients, like they're bioengineered ingredients. Those tend to drive up inflammation for people, generally speaking. I think when it comes to other inflammatory factors, thinking about your glyphosate intake. So, looking at your corn or your oats, making sure that they're glyphosate free, looking to see if you are someone who doesn't tolerate dairy or gluten well, which are very common inflammatory drivers. Okay, I typically do not approach food direction in a blanket statement manner. Some people need to eliminate leptins from vegetables. Some people need to eliminate gluten, dairy. So I really try to tailor it to the patient, and I do typically check an allergy panel for people to make sure we're not eliminating too much. Next question, how do you effectively, safely, and gently detox on a regular basis? Typically, I say, high antioxidant support through food, through regular elimination patterns, through bowels and urination. Use of sauna is a great way to effectively detox on a regular basis. Also has several cardiovascular and brain health benefits. I do use binders on occasion for people that are poor detoxifiers just to make sure that we're adequately supporting detox in the body. And then things like glutathione, milk thistle, dandelion root are all really great options too. Ways to wean ourselves off of anti-inflammatory drugs like LDN and manage symptoms. I'll answer this one in conjunction with another one that asked about weaning off Humira. Um, Weaning off any therapy takes intentional effort, okay? And usually the guidance of a clinician, especially if you've been on it for a long time, okay? So when I think about weaning off of any of the medications, there are several options to use instead to help better support the immune function and calm chronic inflammatory cascades, okay? So I think I mentioned that KPV is a really great option. Um, and then I think it's all about finding that balance with the cytokines, whether they're pro-inflammatory or anti-inflammatory, and finding how can we bring down the inflammation um, by bringing better balance into the body. Okay. Um, Lost my place here. Let me see. Go back up here. Okay. Primary markers that we should look for to determine the health of our immune system. Is blood work the best way to do this? I mentioned a few of the panels that I do for immune function. I like to look at immunoglobulins, um, which tells us how is the body responding to external infarct? What is our baseline immunity looking like? Do we need more support? Okay. I also look at streptococcal pneumo titers, like the 23 serotypes, to see what's our baseline for protecting our lung health. And then I look at several panels for IgG and IgM presentation of Epstein-Barr virus, strep, do we have immunity to varicella, uh, various herpes viruses, etc. Okay. Best foods we can eat to bring down inflammation. I would say focusing on whole foods, focusing on diversity of plant foods, low sugar, um, and organic. Okay. Um, and also water is a big piece here. So looking at your water source, making sure that it doesn't contain some of those forever chemicals that can be problematic for that total body burden. How do you balance workouts and restorative practices to optimize a healthy immune system? We want to keep cortisol in balance with workouts. I see a lot of women doing too much HIIT, too much of the high intensity workout. Your body perceives some of these intense workouts as like a fight or flight response. So is it chasing a cheetah or is it doing a box jump? It's can't really differentiate the two. So when we have too much cortisol, we can have too much inflammation, and high stress can result in immune system dysfunction. Okay. So we really want to balance that out. I really like strength training, walking. I do like to integrate some intense bursts here and there, but really want to make sure that we're keeping that cortisol in check. When thinking about our plates, what is the best way to modulate the immune system? I think I touched on this. Diversity of plants is another thing in conjunction to low sugar that I recommend for just keeping that microbiome really diverse and strong. Help me understand autoimmune issues and worsening allergies. The cascade of driving up cytokine responses and mast cell degranulation is typically the result of worsening allergies. Okay. It results in gut permeability, histamine dumping, and further intolerance of foods. Okay. Can also present with vasodilation of uh, the nasal passages that can result in chronic postnasal drip, issues like that. Sometimes there is pathogen behind that. Okay. Any updates on osteoarthritis and fibromyalgia pain? I talked a little bit about stem cell therapies. Those are very promising for osteoarthritis in healing and repairing damage done to the joint from arthritis, both RA and osteoarthritis. KPV is very promising, and Rachel, our nurse practitioner in the clinic, has kind of been spearheading the regenerative medicine efforts with the joints and the fibromyalgia piece. Can you fully heal or recover from autoimmune disease like Hashimoto's? You can be put into remission with Hashimoto's, but the damage that the thyroid has incurred from the presence of antibodies can mean that you require medication long term or supplementation long term for optimizing the thyroid. Okay. There are several ways to reduce those antibodies: red light therapy, adequate selenium intake, reduction of gluten, sometimes dairy ties into that, getting the adrenals really well supported. And I also use aloe vera for that. That's a very effective therapy for reducing antibodies. Can chronic sinusitis be overactive immune system? If so, what approach is best? Typically, it is from uncleared infection that is yet to be found, or a constant re-exposure to organisms with biofilms, which are particularly hard to penetrate, and result in failed treatments. But I did just mention sometimes we can have chronic inflammation that can result in vasodilation that can, kind of create that like postnasal, never-ending postnasal drip situation. How do I determine the root cause of my overactive immune system? That typically relies on extensive testing. One of the tests I didn't mention that we do is an AVISE panel, which looks at autoimmune. And that can be really helpful for seeing, do we have some autoimmune markers that are popping up? Do we have a high likelihood of like a lupus presentation? But I also like to really look at those cytokines to see where are we at from a balance standpoint. How do we need to kind of modulate the immune system to get us in better check? Are there tests to measure the ability or deficiency of an individual's immune system? I touched on this. Yes, immunoglobulins, IgG subsets, pneumococcal titers, titers to various infections, cytokine panels, testing of natural killer cells, checking on the counts of T and B cells. Where does one start their journey? How long could it take? I would start by meeting with a provider for a comprehensive workup. Okay, several of us approach immune health in a similar manner, but as you can see, there are several tests that can be done to do a deeper dive on what's going on with your immune system. Okay, and it can take anywhere from months to several years, depending on the case. Some people are constantly working to support their immune function because of things like the cell danger response, trauma, things that can really throw the immune system off balance. Does red light therapy really help? Yes, it is very effective in decreasing inflammation. As I mentioned, I use it for Hashimoto's often. Typically, the treatment recommendation is 2 times 10-minute sessions daily. It's been proven to reduce antibodies, and it's particularly helpful for joint and skin issues. What ways can we strengthen the aging immune system for optimal health? I always start with supporting micronutrients, eating a healthy, diverse, and well-balanced diet, doing that sleep prioritization, regular detox, gut health optimization, and then adjunct IV therapies as needed to calm inflammation and support better balance with cytokines. I'll get to the chat questions in just a bit. How do we address old injuries that have caused inflammation? Collagen support with vitamin C, high dose, or just straight collagen, stem cell therapies, inflammation reduction, PRP. Trying to think if the ozone can be a good one. Okay, whether injected into the joint or systemically. Ways to help with fatigue and low energy. Support cellular health with membrane support. So think phosphatidylcholine, the oral dose of PC. I need to look that up. And I do also do IV PC, which I think is more effective for super sensitive patients, people that have absorption issues in the gut. Okay. I will get that for you, the dose of the PC. Um, and low energy can also be supported with mitochondrial support, and with various peptides, think NAD, KPV. How does inflammation, specifically in the gut, usually present itself in ways to reduce this? Inflammation in the gut can present in so many different ways. Okay, it can present with skin issues, can present with rectal bleeding, can present with bloating, can present with issues digesting food, that can present with like floating stools or mucousy stools. um, and that is all, we work with people that have all of the above, and we can do deep dive with stool testing and then really come up with a comprehensive way to support inflammation in the gut. My immunity is low. What are some actions I can take to correct this? I mentioned a few of the therapies, but first doing some testing, but some therapies like thymosin alpha, adequate supplementation, ozone therapy, exosomes are all great ways to support immune function. The other question that this person asked was, an immune specialist recommended I take shots to boost immunity. I said, no, would you recommend shots? I'm not sure if allergy shots were the recommendations. I used to do these a lot in the clinic that I worked at Rush. They can be really effective for giving the body adequate response to things that you are allergic to. Okay. So yes, they can be effective. They're not effective for everyone. I think it's very nuanced. You kind of have to look at what else is going on. IVIG is a therapy that is effective for supporting immune function, and that is something that is a case-by-case basis to boost total immune function, protect the body from virus, bacteria, etc., when you have a chronically low immune function. Okay. Can Lyme or mold be causing high blood pressure and elevated hsCRP? Yes, potentially. We'd want to look at other factors as well in blood work. Already touched on this. Is LDN strong enough to safely get me off of 25 years of Humira? Possibly. There are other options we can use in conjunction with LDN to potentially give you a little bit more support. Okay. How does immune system dysregulation relate to chronic illness? As I mentioned, it can be that cyclical loop of the cell danger response that needs to be stopped and corrected. Um, can rheumatoid arthritis and subsequent joint damage be reversed? RA can effectively be mitigated with anti-inflammatory supports. It's all about calming those pro-inflammatory cytokines and balancing the immune response to the joints, okay, to prevent the attack on the joints. We offer therapies like PRP, ozone, stem cell injections to help regenerate the joints, okay? And so, can one reverse RA? It's not really so much reversing, it's more about like regenerating and supporting the or blunting the immune response that results in the pain, the degradation of the joint. Okay. Um, as far as I don't have any more questions in the submitted questions, but I did see, do you have a recommendation for a red light for home use? I'm gonna just Google the one that I like. I can't remember the name of it. Home light. Like a handheld one I'm thinking of. Why am I blanking on it? I think it's Juve. Yep. Juve, Loombox, those are all good. Um, yeah, Loombox is a good one and Juve. Um, oral PC dose. Let me look that up. I think it's anywhere from 1,000 to 2,000. It is Juve and Boombox. Just wrote it in the chat. Body Bio PC. So I use Body Bio PC a lot. And the dosing on that one is, why can't I find it? Yeah, it's typically like 1,300 milligrams in the oral. And that's two soft gels. So I typically have people doing two soft gels, or the equivalent of what it would be in the liquid form. And that just kind of depends on preference. They're kind of big caps, so it's kind of variable. Okay. And to answer Dixie, it's Joov is how you spell Juve. And Loombox is Lume box. Okay. Um, and I think that wraps it up, you guys. Thank you so much for your time today and for listening. And I'm so appreciative of everyone who joined today. If there is anything you have follow-up questions for, feel free to set up some time with me. I know some of you are my patients, so I'm so glad to see some of you here. And thank you so much for your time this evening. Take care.